Hello and welcome to another episode of Diabetes Dialogue, Technology, Therapeutics, and Real-World Perspectives, where we are still at the ADA Scientific Sessions in Orlando, Florida. I'm Diana Isaacs. I am joined by my co-host, Natalie Bellini, and we are very excited to have another special guest. We have Dr. Monica Gomberg from Blue Circle Health. I hope I got that. Did I get that right?
Perfect.
Okay, great. I don't even have notes. Dr. Gomberg, if you don't mind introducing yourself and your background to our audience today, we're so happy to have you.
Yeah, thank you so much. It's really an honor to be here and to meet you all and to be at this conference. But I'm the Vice President of Clinical Care at Blue Circle Health and the practicing endocrinologist of the company. And tell you about Blue Circle.
We'd love to know it. Where did you come from before you, of course, came to Blue Circle?
Yeah.
What is your clinical background?
So I trained at University of Pittsburgh Medical Center in Pittsburgh, not far from you guys.
Yeah,
we're neighbors. And then I joined private practice where I was an owner in practice with my co-owners for many years and really dove into the broad endocrinology treatment space, but really loved treating my patients with diabetes, and found that we were really struggling in getting them what they truly needed. And I was able to provide clinical care, but other than samples, there was not much more that I can do for the patients who couldn't afford their care, who need more. So I decided to look for something different where I can really make an impact. And that's where I found Blue Circle Health. And what we're doing and creating as a team is something really, truly bigger than any one of us. And that's what brought me to this space.
I love that. That's amazing. Right. That sounds a lot like what we try.
Right. I love that you have the clinical background.
Yes. And that we struggle trying to get things for that.
Yeah.
You know, it's like we can get someone with Medicaid on a lot of different things and we can get someone with, really great private insurance, but that high deductible plan, those things in between, those people that fall through the cracks, really, and I know Blue Circle Health really focuses on type 1 diabetes.
Yes.
But let's start at the beginning. Where did Blue Circle Health, where did it come from? How did, tell us a little bit about it.
Yeah. And so in what we were just talking about, basically, we started from the need that we know what patients need with type 1 diabetes, and we know what we can provide. And there's a big gap between that. And so Blue Circle Health came out of the idea of how do we fill that gap? How do we make it better, not only for patients, for practitioners, for people, pushing for this space to get better, for everyone involved. And so it was kind of a meeting of the minds in creating Blue Circle Health. And we are very fortunate to be backed and funded by the Helmsley Charitable Trust to create the space that we are creating. And so we basically created a company that is giving clinical care to patients who have type 1 diabetes. And we provide an array of services that I can certainly tell you more about, but it is not just endocrinology care. It is a full holistic care for the patient.
And so this is a nonprofit?
It's a nonprofit 501c3 organization, and everything is free direct to the patients that we impact.
This is incredible.
So is this, I have so many questions. Is that virtual care?
Yeah, so it's all virtual care. So our patients are currently in the state of Florida. We will be expanding beyond that by the end of the year. The people who work for Blue Circle are all across the country, so everything is virtual. So we are able to get the patient where they're at their place of work, at their place of home, wherever they are. We see them virtually. We never lay them down with a bill. We never charge them for our services.
And so what can you offer someone? Can we go through a little bit of that? So if I have, we talked a little bit about medication, right? So I have a high deductible plan, but also a lot of these people have other struggles too. So can you talk to a couple of can you give us some examples of what patients come and what you can do with them?
Absolutely. So everyone that comes through our door, we ask them basically what their needs are. And a lot of people don't know what their needs are, and we help work with them to figure that out. Well, we offer not only endocrinology care, but we offer education and nutrition support. We offer insurance navigation. So that's a big thing in people to understand what their insurance does cover. Maybe they were told they can't get their prandial insulin, but really it was just they couldn't get Humalog, but they can get Novolog or whatever it might be. We offer diabetes supportive counseling, which is to me something that I've always dreamed about having. Patients live with a lot of distress surrounding their T1D care, as we know with the DDAS scales that are performed, and to be able to serve that need. So we have that. We have peer support coaching. So patients who have never met anyone who lived with type 1 before now have a friend and a peer who have gone through the same things that they've gone through, and oftentimes are in the same communities that they've lived in. And so that is offered to them as well. So we have a total of 6 services. I hope I'm not forgetting any. I mentioned insurance navigation. And we also have 2 programs. So we have prescription assistance program, and we have an intro to CGM program. So hoping to get people in the CGMs in the hands of the patients who deserve it and want it and have never had one before. And also we can offer through our prescription assistance program free 90-day supply of anything and everything related to their T1D care. That often is 12 to 15 prescriptions. That is free to them if they apply to the program. And we've served a lot of patients that way.
So that really, it sounds amazing. So I understand this is in Florida right now. So how, let's say someone's living in Florida, how do they get involved? Like what's the criteria to be eligible?
Right. How do I?
So our eligibility criteria, anyone can call us. So you can go to our website, bluecirclehealth.org, and you can see if you're eligible for enrollment right on there. A provider can also send a referral directly to us. We serve patients who are 18 and up, so adults, but we do hit that vulnerable time range of, transitioning from pediatric to the adult world. Patients can be English or Spanish speaking, so our team can support fully Spanish speaking throughout their journey. The patient must have access to virtual care. Doesn't mean they have to have an iPhone, but it means they need to get to some sort of mode to get on a video chat with us when they have their appointment. Currently living in the state of Florida. Non-pregnant at the time, just because we think that those patients deserve really in-person care, and we don't want to jeopardize that. And the patients, I talked about virtual care. The state of Florida I talked about, but we'll be expanding beyond that. And then, they must have a PCP or willing to be connected to one. And so the aim of this is never, ever to replace the care that they're already getting, the really great care they're already getting. So we want to keep patients in their medical home. We provide our notes and we communicate regularly with the PCPs and the clinics that we work with. And so it's a constant two-way door. And because our program runs for 6 months, it's something that they're not with us long term. We want to make sure that they actually stay in the homes that they are.
So the idea is to kind of get them set up for the 6 months.
And just float them again, right? Get them back to baseline.
Yeah.
Or the baseline is that gives them a fair chance to continue this care long term.
Exactly right. There's a real, I think, gap in patients feeling empowered in their care and patients really understanding how to make changes, how to go through, life difficulties and managing their T1D medications and really making day-to-day decisions as they have to make all day, every day. And so having them feel empowered in that, having them feel empowered in understanding what their insurance covers and understanding how to call up an insurance company and ask questions if their insurance were to lapse or change in any way. And so just giving them the tools to be successful. And so that's what we really try to do in that 6-month time frame. And we've had really great feedback from our patients and providers that we've worked with.
So these are referrals from primary care, or so I practice in endocrinology. Could I send you somewhere?
Absolutely.
Okay. It can be either way.
It can be either way. So I think about, my previous practice and private practice, what I was dealing with. And I would see a patient in 20 minutes, right? And I was dealing with hypothyroidism, hypertension, type 1 diabetes. And by the way, this other thing came up today that took 15 of the 20 minutes of the call, right? That's for usual appointment. And so I, as an endocrinologist, would have loved something like Blue Circle Health to say, I'm going to see you in 3 months, but I know you're going to be cared for in this time. I know somebody else can help me educate you. I can send you to the educator at Blue Circle Health. I can send you to the peer support coach to know that you have someone else in your corner. And yes, I'll see you in 3 months and continue everything we've been doing. And of course, I'm here for questions. It's a great support for me as a doctor, a great support for the patient.
What type of outcomes are you collecting from this program?
So we will be looking at, we'll look at clinical outcomes in terms of GMI, time and range. We're going to see the patients that we get on CGM, and we've gotten 30-something% of patients we've given CGM. We've never had it before. I think it's about 37%. And so we're collecting that information. We're fully data-driven, so everything we do is based on what the outcomes that we have. We get DDAS scores at the beginning and at the end of their journey in the 6 months to figure out, is their level of distress changing? We're currently collecting that, but I tell you it's actually pretty good, and it shocked me. I didn't think it would change so much in 6 months as it has been. And so we are looking at that outcome as well. And then overall, our population statistics and who we're serving versus who's living with type 1 in the United States. And
how many people have gone through this program so far?
We currently have about 273 patients that have gone through the program, and we've had about 57 patients who have become what we call full circle, meaning completed their time at Blue Circle Health and gotten their needs met. That's the most important part is we want to make sure that they feel confident in what they came in with.
Sure. So a couple of things. How I want this you want this, right? We want to do this now. We want to refer.
I'm greatest about the business model.
Well, so when you get to do this, so you have this person, when you look at those 260 people and you have 6 different options, right? What is the average number for each person? How many different options are they actually being prescribed or using or being referred into?
It's a great question. So we definitely measure that. We assign everybody a peer support coach. So that's almost, it's going to be 100% of the patients, and it's at like 99 something for the patient to come through the door. I would say the next highest is 80-something% of patients are getting matched with an educator, because that is what they're truly representing that they need. And when we see them, we're making sure that we connect them to. The next highest is endocrinology care alongside insurance navigation. We work very hand in hand, as you can imagine, to make sure our prescriptions are matching what they can actually get. And so that's the highest that we're seeing in terms of what people are identifying as their biggest need.
Yeah. All right. So now, let's go to the business model.
Right. Yes. Obviously, like right now, Helmsley is funding it, which is great.
Right.
But, like, what's kind of the long-term strategy?
Right. So I think the biggest thing and the most important thing, right, is proving that what we're doing is incredibly helpful for a patient.
Right.
And, obviously we're going to take as many patients as we can possibly get and continue to serve them. We will never stray away from that. The secondary goal is to say, okay, right, Helmsley's funding us. We're very fortunate for that. And not everyone will have Helmsley, and we'll have to figure out models to make this happen. But I think one thing that we can truly have a massive impact on is proving why education needs reimbursement, proving why everyone should have an educator and not let them go because it's not bringing money in for their hospital, proving why insurance navigators are important as part of their care plan, like proving why these different things deserve the fee-for-service, like feedback from insurances and from payment plans. And so we can make an impact in that way to say we can take bits and pieces of it and have a long-lasting impact and really make a difference. And also just make sure that we can prove to patients that we can be this beacon of hope and say, this is how things should be. And, this is how we can work together, and maybe identifying that social work and case management should be part of their plan and seeking those things out.
Wow. Yeah. It would be so great if these services were covered by insurance. How far out are you going to follow patients? Because I would envision the 6 months they're in the program, like you would hope that they're going to improve.
Right. I'd love to see 1 year later.
Right. Like as they're not.
Or 6 months later after discharge.
Yes. Yep. And our plan currently is, we're surveying them at the beginning and the end. We plan to survey them at 6 and 12 months, and we're developing what exactly will be involved in that. We want to make sure nothing is a huge burden for a patient, but yet it's important for us to make sure that we know what's happening. We're trying to incorporate hospitalization, like these HEDIS measures that if we're able to pull them out from these patients would be really impactful to have.
Absolutely. Approve those things, right? And then I guess my only other question is, so now they've come full blue circle. Now I understand the circle. Is there any peer support or long-term thought of, wow, we could create a support group now, and then when people start to kind of have challenges, they could get on with their other peers? Is there some plan? Because I need that too. I'm greatly.
Yeah, absolutely. So we have these group sessions right now. They're offered for patients who are active in our program, and they carry forward for when they're full circle. So it's a mix of patients who have completed and been in the program. These group sessions have been incredibly successful. They're run by our peer, one of our peer coaches, as well as our nurse practitioner. And our patients love them. Point is, we made them an hour, and they've been asking for them to be longer. They don't want to stop talking, so we're extending them. That's just for step one. Mm-hmm. We are absolutely working on creating a community for our patients. We want to create almost this kind of like alumni network, so to speak, of the patients who've gone through the program. And not only that, the patients who may not want to join our clinical program, but want to feel connected to patients in other ways. So we will be creating a community in that sense, different groups, different education offerings, ways to get involved, both in and outside of the actual program.
Wow, that's amazing. I love that, because it's like you've completed the circle, but we're still supporting that, and we're still helping to bring you up.
More of that. We need more peers.
Yep. It's hard. It's hard to get a clinician to say, Diana, on Thursdays, you're going to run a support group now. Can you take one more day out of your life?
Yeah.
And it's just, it becomes a lot, right?
Right.
I guess my other question surrounds, you mentioned twice now, other states. Are you ready to talk to us about where that might be?
Oh, I'm not ready to talk about it.
Okay.
But you will find out about it by the end of the year. We will absolutely let you know. And it's coming shortly. And we're very excited about it. And we'll let you know how many as well.
So, like, along those lines, how long has Helmsley agreed to fund this project?
Yeah, so Helmsley, they are allowed to do a maximum of every 3 years. So with their writing, right? So they do it every 3 years and reassess. So we are very well on track with that. And they're very happy with where we are. They're very involved.
Right, absolutely.
Yeah, we're really fortunate. And I don't know if you know, but like the trustee from Helmsley that works very closely with us, David Panzier, and I know that I can say this because he says this all the time, but he's very, very dedicated to the T1D space. His family lives with type 1 diabetes. And so I think it's important for me to say, because for those who don't know, the funders are incredibly invested in the people that we're serving. Right. This is not just a project. This is truly from the heart. And that's why I know that this is something that everyone is so invested in, and we're going to really push to make it the best thing that we can for our patients.
Wow, that is awesome.
Yes.
And there's one other question. I know you mentioned like CGM, increasing uptake. Are you guys focused on pumps and insulin delivery as well?
Yeah, we absolutely are. So, there's some things that we are learning in a fully virtual care model, such as the questions that are on the forms that you need to fill out in pumps, a height and a weight, a C-peptide level, things that we may or may not have in a virtual clinic that we have to get. So we're working through all of that. We 100% deal with pumps every single day. And so patients come in, we support them in every way. And I think one of the really most undervalued part of pump management is choosing the correct pump and making sure that it's fit best for the patient. And so we do all these pre-indication, pre-pump, we educate them on it, we work through their pump settings. And we're working now, I just had a conversation with a PCP who has referred to us and making sure that he feels supported in choosing the right settings. And so it's not only direct to patient, but I'm also helping the providers to make sure that they're successful for all of their patients then.
Awesome.
Yeah.
Well, that sounds amazing.
It does. I'm super excited. You guys for the patients. There's a lot of people in Florida alone though that you could, there's a lot. Yeah, a lot of people with type 1 in Florida that there's a potential there alone. You look at, are you going to expand? But really getting the word out there alone is really important.
Yeah, absolutely. I think that there's a lot that we've done, and there's a lot that we're still going to do. And I know, getting to more places is absolutely coming up very shortly, and we're very excited about that. But it's not, I think there's so much to be said about doing this for the patients, doing this for the providers. I think making this a better space for everyone involved. It's, not taking the burdens off of people's shoulders and really making it the best care that we should have in this country, and to no fault to anyone. It's just working in the confines of what we have.
Awesome. Well, thank you so much for explaining that. And I'm really excited. It's great work. And I want to thank our listeners for listening to watching this episode of Diabetes Dialogue. And we hope that you will tune in to the next one. So that wraps us up. Thank you so much.
Thank you. Yes, I appreciate you guys. Thanks.